Hello and welcome to Perimenopause and Frozen Shoulder. Is insulin resistance the missing link? My name is Dr. Blessing, and I thank you all for attending this workshop. Hopefully, where you are, it's nice and sunny and warm. It's raining here in Austin. So let's get this started. If you have any questions, feel free to put them in the chat. I'll try to check it periodically, or I'll answer them all at the end. It just depends on how many questions I get. Sometimes there's a lot of people. And if there are a lot of questions, I won't be able to stay focused and catch them all. So if there are just a few questions, I'll be able to get to them throughout the presentation. If not, I'll just wait to the end and answer them at the end. So my name is Dr. Blessing. I've been a nutritionist for over 14 years, and I am also navigating perimenopause. And so my perimenopausal journey has actually just inspired me to help other women navigate perimenopause with confidence, and then also making sure to empower other women so they can advocate for themselves. Because advocating for yourselves when you go and sit in front of a doctor or a healthcare provider or whoever during perimenopause is very important. So today we're going to discuss how perimenopause affects the musculoskeletal system, and then we'll also discuss some ways to support your muscle and bone health during perimenopause. So have you experienced shoulder pain or stiffness, either after an injury or just suddenly? If you have, you're in the right place. So if you're a midlife woman who's been struggling with stubborn shoulder stiffness, pain, or loss of range of motion. So what is frozen shoulder? So frozen shoulder is a condition that affects the shoulder. And so it's also called adhesive capsulitis. And in some cases, frozen shoulder, for example, in perimenopausal women, frozen shoulder can just pop out of nowhere. It can also be a response to an injury or a combination of both. And so this condition is characterized by, again, it affects the shoulder. There's pain, stiffness, and of course, loss of shoulder range of motion, which is why it's called frozen shoulder. And one thing about frozen shoulder is that the occurrence is actually higher in people who are diabetic. And that's important because during perimenopause, if you've sat in on any of my other workshops, all the other workshops I've done have targeted individual systems. So whether it's the immune system, the heart, different systems. And what happens is during perimenopause, we have estrogen receptors in all of our organ systems. And so the different symptoms that we experience are a result of how that particular system responds to decreasing or fluctuating like high and then low estrogen levels. So it's important to know that we know that estrogen is anti-inflammatory. We also know that estrogen plays significant role in each system. So frozen shoulder, so what happens is it's an inflammatory process that affects the shoulder joint. So there's a joint capsule, then you have the rotator cuff tendons, and you have the ligaments, and then of course you have the joints. So what happens is the connective tissue capsule becomes inflamed. And so when you have inflammation especially in a joint that is made of connective tissue and also cartilage, what happens is the connective tissue will thicken because it's inflamed, and then it'll also form a type of scar tissue. And so that scar tissue is very restrictive. And so that is what plays a part in the range of motion. Could you please mute yourself? And so this inflammatory process that's occurring in the joint capsule is what is causing the frozen shoulder. So depending on who you look at, there are either 3 to 4 stages of frozen shoulder. So I think there's a pre-freezing stage, there's the freezing stage, frozen, and thawing. So the freezing stage is when a woman will notice that she's starting to have decreased range of motion. And if the woman is in perimenopause and has not had an injury to her shoulder, what'll happen is she'll start to gradually notice that she has pain raising her whichever shoulder. When it's frozen is when the range of motion is significantly restricted. And then there's a period where it'll thaw out and that they will regain that range of motion. Now, the amount of range of motion that returns is dependent on what happens during the freezing and the frozen stage. It's important if you're noticing that you're having restricted range of motion, it's important to either be proactive and do home exercises for your shoulder or go and get healthcare provider guided physical therapy where someone can guide you through different exercises so you can maintain that motion. Because if you don't maintain the range of motion, depending on well, it depends on all sorts of things like genetics, things like that. That will play a role in how much of that range of motion you will have at that thawing phase. But this usually all resolves on its own within 12 to 18 months. And so that's quite a significant period of time. Uh, so this is kind of blurry, but what I was trying to convey with this image is here is the actual shoulder capsule here. And you see that this is this connective tissue. It keeps the joints together. It keeps the humerus attached to the scapula here. So it's really important to know that this inflammation, any inflammation you have in any joint, is going to affect that joint. So if you have a lot of inflammation, that joint is going to, for the most part, inflammation is the body's way of healing itself. So if you've had an injury, whether it's a significant injury or just like a strain or sprain, what'll happen is inflammation will kick in because the body is trying to repair the micro tears or the tear in that particular joint if you have an injury. And so what'll happen is it will lay down different types of scar tissue that's not as mobile. And so that is what leads to the dysfunction, so the decreased range of motion and the pain. So, like I mentioned before, estrogen plays different roles in different systems. And so, believe it or not, estrogen plays a significant role in our joint health because, again, I mentioned it's anti-inflammatory. So, it helps protect the joints. So, before perimenopause, when estrogen levels are stable, this is not something that we really have to worry about. But when we enter perimenopause, what happens is there's a gradual, women in perimenopause will progress into a more inflammatory state because estrogen is anti-inflammatory and estrogen levels are decreasing. So when estrogen is decreasing, you have a tendency to be more inflamed. And so this is why we support this with nutrition and then, of course, managing stress and things like that. So estrogen receptors are present throughout the musculoskeletal system and all of the other organ systems. So estrogen is also important because it helps support the strength and flexibility of cartilage. So cartilage, of course, is a tissue that cushions joints. And why this is important is especially why estrogen is important in regards to joint health is because it helps support flexibility of the cartilage, right? So it helps you maintain your range of motion. But during perimenopause, as those estrogen levels are dropping, we're in a more inflammatory state. The joints have a higher tendency to be more inflamed, even with minor injuries. And so anytime the cartilage or the joint is inflamed, this leads to the gradual wear and tear of the cartilage. And so there's mechanical wear and tear from overuse, and there's also biochemical wear and tear, because as you age, we know that our cartilage is different. It doesn't recover as quickly. Same thing with all the other tissues like muscles and the tendons. Just there are different biochemical processes that occur, and these biochemical processes are affected by our diet, how inflamed we are, whether or not, and again, we would throw in the mechanical stresses, all the different stresses, the mechanical stresses, and then the biochemical stresses that are going on in the joint as we age in general. And then you throw in the fact that a woman is in perimenopause and then she's in a more inflammatory state and losing the protective aspects of estrogen. Okay. So estrogen is also important for the production of synovial fluid. Now, synovial fluid is a fluid that is secreted in the joint and it just helps keep the joint mobile. So this helps um, the joints be able to, kind of like if you spray WD-40 on a creaky door, that's what it does. Basically the same thing. It helps keep the joints fluid. It helps the joints move smoothly. Now, lower estrogen levels can lead to reduced joint lubrication, and this can contribute to joint stiffness. So, insulin resistance. So, we know that insulin resistance is a process where the cells are not responding to the production or the release of insulin. And so, there are many ways through diet, exercise, stress management that this can be managed, but it's important to realize that insulin resistance puts the body in a more inflammatory state. And we know that inflammation does not occur in isolation. If you have inflammation in one joint, believe it, you're going to have it in the rest of the body too. It just depends on the extent or if there is an injury. So we know that insulin resistance, it increases inflammation, and we know that when we have inflammation in the joints, this leads to the breakdown of the cartilage. We know that the cartilage is important for smooth joint motion. We also know that estrogen is needed for joint health, for cartilage health, but also the insulin resistance affects this because it is increasing the inflammation. So not only if a woman is insulin resistant, not only is she insulin resistant, she's also in perimenopause. So that means that she's already in an increased inflammatory state. And that increased inflammation is definitely going to affect the joints. And in this case, we're talking about frozen shoulder. So the STABILE framework is a framework that I use to help people not just address the musculoskeletal health, but since that's what we're focusing on now, these are the ways that you can help protect and promote joint health, even though you are in perimenopause. So again, we want to stabilize blood sugar. I mean, we want to stabilize blood sugar because we know that when we have an imbalance in our blood sugar levels, this increases inflammation. And we know that inflammation is very significant and it's one of the main causes of frozen shoulder. So we know that when you have a lot of inflammation, it can break down the collagen in the tendons and your joint capsules. And it also slows down the tissue healing process. So some things you can do is, again, everyone hates it, but focus on adding protein and fiber and healthy fats to your meals to help stabilize your blood sugar, so you don't have those rapid spikes. Pair starchy carbohydrates with protein or fiber. So you want to eat consistently. A lot of times, especially during perimenopause, if you skip meals, this can lead to an imbalance in your blood sugar levels. Again, we know that when your blood sugar levels are not balanced, this can increase inflammation in the body, and we know that inflammation is not kind to our joints. If you have experimented with fasting and you can tolerate it, so for example, if you have diabetes, I would talk with your healthcare provider about it. But if you just have some blood sugar imbalances and you have not been diagnosed with diabetes, you can try some gentle fasting. So try whatever works for you. When you fast, again, for people who do not have the diagnosis of who are not in diabetes or who do not have diabetes, this can actually help improve your insulin sensitivity, but this is something that you should try and test on your own. Everyone is different. Some people can tolerate longer fasting periods and some people cannot. And again, if you have been diagnosed with diabetes, it's important that you talk with your healthcare provider before you do any type of fasting. So rest. Deep sleep is so we go through different stages of sleep, but deep sleep, REM sleep, is where our body goes through a deep restorative process. And then doing this deep restorative process, this is where tissues are being repaired. And so when you don't get enough sleep, what happens is cortisol, which is the stress hormone, increases, in addition to the fact that you're losing the anti-inflammatory properties of estrogen. And this can increase inflammation, which slows down healing and can decrease your range of motion. So make sure to prioritize sleep, get 7 to 9 hours a night. Again, keep a consistent bedtime. You can create a wind down routine, dim lights, reduce screens before bed. You can create a routine where you either do stretching or you take a warm shower or you take magnesium glycinate. One note on magnesium glycinate. Magnesium glycinate is great for, let's say, if you have anxiety before bed. But the great thing about magnesium is that it can help manage stress too. So not by itself, but it can help the body kind of relax because magnesium helps muscles relax. So if you add this into your wind down routine and you also make sure you're tweaking your nutrition to make sure you're eating healthy fats that help with inflammation, also adding that fiber and the complex carbs. This can help in that healing process if you do have frozen shoulder. Okay, and of course, in order to prioritize sleep, you do have to create an environment that supports sleep. So your room should be cool, dark, and quiet. So, of course, we know that when we're stressed, this kicks the body into fight or flight. When our body is in fight or flight, we are tense, right? That puts increased tension on the muscles, and that actually decreases blood flow to the joints. So we have the fight or flight system, which sends the fight or flight sense though. So we have the fight or flight system, and that helps you prepare to face a threat. So what happens is when you are in fight or flight, your muscles tense up, you're ready to face that threat. And what happens is blood flow to the joints is decreased, right? Because it's going to the muscles because it's trying to get you ready to fight or flight or run, right? And so when it's important that if you have a lot of stress in your life from work or any of the things that are going on, it's important to make sure that you have a routine that'll help you recover from stress because rest or digest is that restorative side of fight or flight. And rest and digest, again, like I was saying, it helps support healing and restoration after you've been in a stressful period. So whether it's your brain, whether it's your heart, anytime you are chronically stressed and you don't deal with that, that just leads to increased biochemical wear and tear on your body, your heart, your tissues. So it's important to make sure that if you're very stressed, you have some sort of routine so you can kind of reset and help your body repair. So you can do daily decompressions. Breath work is a simple thing to do, guided meditation or journaling. Again, parasympathetic prep. Deep breathing is a way to turn on rest and digest. And then, of course, setting boundaries and taking breaks throughout your day. Okay, so repair. So make sure you're eating foods that provide the building blocks to help restore the joint capsule, help your muscles heal. And this is why it's important to make sure that you're eating enough protein, because protein is broken down into amino acids, and those amino acids are the building blocks to our tissues. So if you're not eating enough protein and you're in an inflamed state and you're chronically stressed, you're not supporting your body throughout this stressful period. So whether it's perimenopause, you just have a lot of stress on top of perimenopause, it's important to make sure that you're getting these building blocks in your food. And so yes, if you have nutrition deficiencies, it is going to slow down healing of your tissues, the tendons, the joint capsules. So some action steps is to look, if you want to do collagen support, 10 grams of hydrolyzed collagen, making sure you're getting vitamin C, because vitamin C, not only does it help with the immune system, right? Inflammation affects the immune system, but not only does it help the immune system, vitamin C also helps with the repair of the muscles and the joints and the collagen that makes up the joint capsule. So making sure you're eating anti-inflammatory foods, because again, when you are in perimenopause, when a woman is in perimenopause, what happens is, again, you're entering a more inflammatory state. And so you're entering a more inflammatory state, you're producing less synovial fluid. All of these things kind of add up. So it's important to make sure that you support not healthy inflammation, but you control or manage inflammation by making sure that you're eating foods that tone inflammation down. So that's fatty fish, turmeric, ginger, berries. These foods all are anti-inflammatory, and they have different that help tone down inflammation. Can you please mute yourself? So also you can take an omega-3 fish oil supplement. Again, if you're taking other medications, I would always check with your healthcare provider, because you don't want to, there are quite a few different nutrient drug interactions. So if you're taking any other medications, just check with your healthcare provider first. You can also add zinc. Zinc is very important for tissue repair. Again, I already mentioned magnesium, and then vitamin D. Okay, so gentle movement. So gentle movement actually helps keep the joint mobile. And this is why I said that if you sense that you may be having symptoms of frozen shoulder and you catch it early, this is why I said to make sure that you can do a home exercise program, or you can go and seek guided treatment from a physical therapist. So the whole phrase, if you don't use it, you'll lose it, that is 100% true when it comes to joint motion or motion in general. And the thing is that gentle movement or movement, it helps keep that synovial fluid flowing, and it helps prevent adhesions. So these adhesions are formed when the cartilage that surrounds the joints is healing, right? Because the collagen is a different type of collagen that's less flexible. And so if you have adhesions in your joint capsule, any of your joints, what'll happen is it'll stop your joint from moving smoothly. So if you are in physical therapy, they're going to make you keep moving. And when you get through that thaw phase, you're going to have majority of your range of motion. You're not going to lose it. So progressive strength workouts help rebuild this, and it helps if you build up your muscles, like if you have weak muscles, it's best to build them up because the muscles and the ligaments in the joint capsule are what actually support the joint. So you can do passive stretches. So the wall crawl, again, making sure that you're adding in some strength training. If you are in the early stages of frozen shoulder, this is something that you would do with your physical therapist. Again, mindful movement. So you can also add supplements, and I kind of mentioned some before. And basically what supplements do is they just fill nutritional gaps. So during perimenopause, a lot of women are deficient in vitamin D, magnesium, definitely, and then some are deficient in calcium. These things are needed for to help maintain bone health, collagen health, muscle health. So if you go get blood work done by your healthcare provider and you're deficient in any of these things, calcium, magnesium, vitamin D, and those three all work together, it's important to make sure that you're filling that gap. And then once you have taken those supplements and you notice the change, notice the a difference, which usually takes 3 to 6 months with most of them, it then you know that you're helping support your body during perimenopause can be a stressful time. So the stressful um, period of perimenopause. And so this doesn't mean go and buy every supplement just where you have a deficiency. You wouldn't believe how many women come to me with like bags of supplements that they have from some functional medicine practitioner that they don't take and they don't know why they're taking them. Again, just identify what deficiencies you may have by going and getting blood work with your healthcare provider and then address those. You don't need to have 20, 30 different supplements. I mentioned the omega-3s. The omega-3s are good. You can get them with food, through food, and you can also take a supplement. That basically helps tone down inflammation. And again, we know that inflammation is very harmful to our joints. So there's glucosamine and chondroitin, curcumin, and boswellia. Basically, these are anti-inflammatory herbs. Magnesium citrate and glycinate. Both of these help the muscles relax. And magnesium glycinate also helps if you're feeling anxious, right? So if you store tension in your body, magnesium glycinate is very helpful. And magnesium glycinate actually works pretty quickly. Again, I mentioned vitamin D3 and K2. Don't forget to add the magnesium there. They're important for bone and connective tissue health. And the connective tissue also includes muscles. So muscles, ligaments, tendons. Again, we want to make sure that we're reducing inflammation. So if you have unstable blood sugar levels and you're not quite at diabetes, adding in anti-inflammatory foods can hopefully help you reverse this. We know that some women will develop during perimenopause sensitivities to different foods they weren't sensitive before. I would say make sure you track and then cut out or reduce these triggers. So it could be dairy, gluten, sugar, just depends on what it is for you. But tracking is a good way to identify what specific triggers you may have. And I've had clients and patients who they've either cut back on gluten or sugar and they have less pain and they're able to better tolerate physical therapy. You can also, when you're tracking, you can do short elimination resets. And this is not a diet. You just want to take out different foods that may be your triggers, so you know that it's your trigger. So you can either cut it out or reduce it. You can also introduce herbs like turmeric, I already mentioned, and ginger. Uh-oh. Okay, so we're at the end. I'm going to check and see if there are any questions. Okay, are there any questions that anyone has about perimenopause and frozen shoulder? Okay, go ahead. And
Hello, hi. Thank you for the presentation. I do apologize. I wasn't able to be able to log in the very beginning.
Mm-hmm.
So I missed I believe, two slides or maybe three. I'm not really sure, which was for the cause or the link between the menopause and the shoulder pain. Do you
Mm-hmm.
think I can, is it recorded or something like that? Or
Yes, it's recorded. I can send the link to the replay. Just put your email address in the chat and I can send that to you.
Okay, thank you. Another question. I understand with the premenopause that certain things affecting the joints and muscles, and that could cause the pain. But what about if the pain was initially because you fell down, for example? So it was an injury, but in the same time you were going through the menopause. So what do you advise?
So, so when so the thing is with frozen shoulder, it can be like if you fall down and you fall on one of your shoulders, but you don't really hurt it, you there's a combination. So it can easily be caused by trauma, like significant trauma, or just a minimal strain. Or some women, it just comes out of nowhere, and theirs is strictly hormonal. So you have to, with that, so since we know that when you enter perimenopause, what happens is you're in a more inflammatory state. What I would recommend is to tone down inflammation with diet and with nutrition. And then if you're having trouble if you're having significant trouble raising your shoulder, I would say to go to a physical therapist and they will kind of, I don't want to say push you, but when I have people go to a physical therapist and they have either an injury or their frozen shoulder came out of nowhere, they push you to stay a little bit more mobile than if you would by yourself, if that makes sense. And so
Mhm.
that helps you protect your shoulder range of motion. But in addition to that, I would say making sure that you go and get lab work, because if you're diabetic or pre-diabetic, which is something that can occur when you enter perimenopause, because you're in a more inflammatory state, muscle mass decreases if a woman is not making sure she's strength training. So it's not just maintaining the range of motion, it's also addressing any blood sugar imbalances or any inflammation in the body that may be linked to poor stress management or bad nutrition, like eating a lot of, let's say, fried foods, eating a lot of processed foods. So it's not just, hey, let's preserve that range of motion. It's also, let's address anything that's causing inflammation in the body, just in general, because it's going to affect the shoulder, and also making sure that we balance the blood sugar levels. Does that make sense?
Yes. The thing is that when I get that injury on my shoulder, actually it's not
Mhm,
only my shoulder, also my knee and both of them the left side.
mhm,
In the same time, I was going through like pediatric surgery, which helped
okay,
me to work on my diet and help me to lose weight, which is a
mhm,
great, but in the same time, my injury is not helping me to be more active. So for me to do exercises or even hiking, of course, things with my leg because my knee is hurting me, and also whatever I would like to do with my shoulder, it freezes in a certain position. I cannot extend it more, right? So I started go to a physiotherapist, and one of the things that they do for me, they use something called a shockwave,
uh-huh,
which make it like less pain when I go and like if I try to do something or I have to do some chores and it's painful when I go to them, they do it for me. It calms things down, but it's not like fixing it. I heard recently that there's something called a soft wave, I'm not really sure yet what is that because I still wasn't able to book an appointment to see it. But I mean, I'm still looking for, getting a fast solution, or at least to know what's the time frame to look for if I'm doing these things, and if it was really helpful, or you advise me to do another thing with the physiotherapy, because this is what they did for me with the shockwave.
Hmm.
But up to now, I don't see like it's I like honestly, I feel like it's like a Tylenol, like you're taking something to numb the pain, but it's not like resolving. So, do you have any advice regarding that?
So depending on because there's 3 to 4 phases of frozen shoulder. So depending on the shoulder that you're in, that not shoulder, my bad, the stage that you're in. So there's pre-freezing, freezing, frozen, and thawing. So that can take 12 to 18 months. So there's no quick fix for it. Once you definitely know that you have frozen shoulder, those
Mm-hmm.
phases, you have to go through all those phases. There's no way to skip through it. So the physical therapist, while you're there, they're definitely going to, the physical therapist or the physiotherapist, they're going to do anything, they're going to do things to help decrease the pain so they can help you with your mobility. But there's
Mm-hmm.
no way that you can promise that the pain is going away because again, that inflammatory process has already started. And so the
Mm-hmm.
thing that you have to focus on is supporting your body, making sure that you're adding you're toning down inflammation and balancing your blood sugar levels because those are two things that kind of flare up and can help you and wears down the connective tissue, the collagen, and then the cartilage in the actual joints.
Mm-hmm. Mm-hmm.
So it takes 12 to 18 months. There's no quick fix. And even if you have to decide whether you're going to go for the other treatment, but you have to think, when did this start? And then add 12 to 18 months to it because you can't just fix it. Once you enter, you go through those stages. And I think how
Mm-hmm.
long and how well you do is, are you staying mobile? Is that shoulder or knee staying mobile? And knees are
Mm-hmm.
tricky because all of your body weight is on it. So you definitely have to be careful. So um, you want to stay mobile, but you also want to make sure that you support your body so that you tone down that inflammation. And so that inflammatory process is not just raging while you're, doing the mobility exercises and then getting the shockwave treatment.
Mm-hmm. What about estrogen? You mentioned that one of the reasons that the estrogen get lower. Is it advisable to speak with the family doctor that maybe I can take something for increasing the estrogen?
So yes, you can always talk with a healthcare provider and get on either bioidentical. I always say bioidentical is better, but it is up to you. You make that decision. So you can do hormone replacement therapy. There's the conventional one, and then there's also bioidentical hormone replacement therapy. So the bioidentical one it's plant-based, but the hormone is more similar to the one that our bodies make. The conventional one, I think it's taken from horse urine, so it's a little bit it people take it and it can help improve that. And in some cases, when women start hormone replacement therapy, they are actually like their frozen shoulder may go away. So again, that's not everyone. Things are different. Everyone's body responds differently. But I would find a healthcare provider that specializes in hormone replacement therapy, whether it's bioidentical or conventional. Um, a family doctor may do that, but find someone who has expertise there because it's kind of the wild, wild west.
Mm-hmm. Mm-hmm.
Yes, but it can help.
Okay. May I ask you, I do apologize. Could you put the two methods for the estrogen? Sorry,
Oh,
I
no
didn't know how
problem.
that's spelling. So,
Okay, so Soul Brown says, I went through frozen shoulder experience because of perimenopause, but you didn't know what it was. A lot of women don't know. It came out of nowhere. Yep. By the time I got through it, from freezing to frozen to thawing, I was diagnosed with rheumatoid arthritis. Is there any way to reverse the damage? So, do you mean to reverse the damage from the frozen shoulder or the rheumatoid arthritis?
I'm thinking more about the rheumatoid arthritis, because I think that that's what resulted as out of that. Maybe, as you mentioned, like the lack of collagen or estrogen or things like that. Um, and I also, have done supplements and had, different treatments and things like that. And to your point, I do think like some variations with my diet have helped, right, along with some of the medications. But essentially, I'm at a place where I don't have severe rheumatoid arthritis, but I have certainly now from through blood work some indications, right? Um,
Mm-hmm.
and so I'm wondering like if there's any of these things that you're talking about, like again, around the collagen, around the diet, that could help to mitigate some of that arthritis now, that situation.
So with rheumatoid, I think rheumatoid is linked to the immune system. So it's usually more of an autoimmune form of arthritis. So we
Hmm.
have rheumatoid and then we have osteoarthritis. So
Hmm.
frozen shoulder is definitely can definitely progress to osteoarthritis, which so we know that as we age, right, our tissues don't heal as well. And so anytime we have inflammation in our joints, what will happen is it wears down on that cartilage. The problem is we only have so much cartilage. And when that cartilage is worn down in osteoarthritis, which is what typically results from frozen shoulder or inflammation in the joint, it can. What'll happen is um, it just it wears down that cartilage, and then you're bone on bone. And so some people, there are some experimental trials where they go and they put collagen and some other things in the joints to try and help it heal. I don't know what the studies show. I just know that some people, it doesn't work for them. Others, they go and get knee replacements. And I'm talking about in the knee, but it can apply everywhere else. And the solution for that cartilage damage is knee replacement. But for rheumatoid, it's more of a autoimmune response. And unfortunately, during perimenopause, again, it not only estrogen plays a significant role in your immune system. And so what happens is some women during perimenopause, they'll start to get autoimmune conditions because of the response to the decreasing estrogen. And so I do not know of any surefire way to reverse the wear and tear of the cartilage. Again, there are experimental treatments. I just don't know how. Um, it would be best to talk with an orthopedic surgeon who does this all the time, right? The orthopedic surgeon will be able to, they have however many patients they've tried these different experimental treatments on, and they would have um, a better outlook on, is this something that's helpful? Is it not helpful?
Right.
But
That's very helpful. Like, and again, I don't have severe disabilities with the arthritis. In fact, it's just right now in a few
mhm,
places, but I just have like, high rheumatoid factors, right, in terms
yeah,
of the blood work. So, it's heading in a certain direction. But to your point, it's autoimmune, right? It's an autoimmune
yes.
situation. And it does seem like it as again one of these kind of results out of that perimenopausal uh, experience, right? And so I
Hmm.
My question is, can doing some of these things that you've discussed, can those help, which might, tone down that disease a little bit in terms of
It
the autoimmune uh, situation?
it can help prevent further damage. I
Hmm.
just don't know the extent of reversing all the damage because once that cartilage is gone, um, it's very difficult to restore it.
Yeah.
But again, orthopedic surgeons like they have all sorts of different um new treatments that come out. That's why I'm saying like they would know.
Hmm.
I'm not an orthopedic surgeon, so I don't know all the top things that come up, the experimental treatments and things. But I've had several patients and clients who have had it and had certain treatments. Some work, some didn't work. Majority of them, though, what they noticed is when they cut out their triggers, which was usually gluten, and sugar, they noticed they had less flares.
Hmm. Okay.
So, um, anything that tones down inflammation is not going to stimulate the immune system and is not going to progress the wearing away of the cartilage in the joint
Right, right. Yeah, very
or
helpful.
inflaming the surrounding tendons, ligaments, tissues,
Hmm.
because that's those the surrounding ligaments, tendons, and tissues that can also cause pain too. And then our tendons, the ligaments, they don't have as much blood flow, so they heal very slowly. So when they heal and there's scar tissue, it's going to affect your range of motion. And so, like the first lady was saying that she wasn't able to go hiking and she's having restricted range of motion. It it affects everything. It's not just, hey, it's the joint, right? It affects everything. And the joint is composed of the muscles, the joints, the bone, everything.
Yes, yes. Thank you. It's very helpful.
Okay, and then you said, are there ways to add estrogen back in the body? So the only way I know to do that is to decide to do hormone replacement therapy, whether that is bioidentical or conventional.
Mhm. Okay.
And I
And
would
what about the
talk with
collagen?
someone, huh?
I'm so sorry.
Oh,
I
no
was
problem.
also curious about the collagen too. Is that something you can add?
So with the collagen, I think it's best to provide your body with the building blocks so that it can make it itself. And
Mhm.
so I'm not big on the collagen powders because I don't think that's really absorbed well. But if you're eating enough protein, you're providing your body with those amino acids and the body knows how to um like if you have a strained muscle, you don't have to tell the body, hey, this is what you need. If you're getting enough protein, it'll take those amino acids and it addresses whatever area needs to be repaired and restored.
Okay.
This is another reason why I mentioned turning on rest and digest. So if you have a lot of stress, which pain causes stress,
Mhm.
joint pain causes stress, finding ways to tone down that stress that'll put you in rest and digest, prioritizing sleep so you're getting good deep sleep helps in addition to adding protein rich foods that provide the amino acids needed to repair all of the tissues in our body. Pairing that with deep sleep helps the body restore and repair as well as best as it can.
Mhm. Mhm. Great, great. Thank you so much. Very helpful.
Hmm. Thank you so much. Okay. The recording. I think there were a few other hands up. If you have your question, you can ask your question now.
Hi there. Is
Hi.
This is Tiana, and I kind of had a question in regards to you speaking of the frozen shoulder and the inflammation, and then just kind of listening to some of the other ladies' stories. Mine with me, I the frozen shoulder, could it go in different steps at all, or can it? Sorry, I'm not forming my words the way I want to,
Oh
but
no,
what
go. It's
I
okay.
have sarcoidosis, which again is an
Okay.
autoimmune
Yeah.
thing. So with perimenopause already causing super inflammation, and then that inflames my sarcoidosis even more. So then, there's the extra fatigue. I'm dealing with bone on bone erosion in my hands due to arthritis. But, it's just anything that you would be able to, I guess, shed any knowledge on that, or dealing with some of those things and inflammations, or adding to it beings that dealing with sarcoidosis with it, because I've had a hysterectomy, so I'm definitely perimenopause.
Yeah, you gotta like a triple force there.
Oh my
So
gosh, yes.
I'm not so I'm not as familiar with I know what sarcoidosis is, but I'm not familiar with the treatments just off the top of my head because I don't see patients that have it. I've heard of it.
Mhm.
I know some people manage it. Like but I don't deal directly. Am so if someone does not have diabetes, right?
Mhm.
Most of the so if someone doesn't have diabetes and they're having continuing inflammation despite diet, despite managing stress, despite getting adequate sleep, I know that there are other treatments. Some people will give like steroid injections, right? To help tone
Mhm.
down that inflammation. Like I know, um, I have a friend, her husband has what is it, ulcerative colitis. And there are times
Mhm.
where he is fine. When he hits a flare up, they automatically know doctor will send him in. He'll get a steroid injection, a steroid injection, and that will help him. Like it's kind of like a short term. It helps him cope, so it tones that inflammation down, and he doesn't have
Mhm.
the severe symptoms. So that's if you don't have diabetes, because if someone has
Mhm.
diabetes, that can actually raise the person's blood sugar even more, right? So if someone has that,
Oh,
yes,
that's
yes,
good to
yes,
know.
steroid injections. Mm-hmm. Steroid
And would
injections
that
can
kind
mess
of be
with your
the
blood
same
sugar.
for like pre-diabetes as well? I'm sure like it's going to raise your blood sugar if you're already kind of borderline. So that,
It
um,
will. It will.
that makes so
And if
much sense.
someone it has diabetes, it's even more significant. So if you're pre-diabetic, and of course you would know if you're pre-diabetic by going and getting your lab work. So your HbA1c, insulin, people don't test for that one, but that one's very important. It needs to be under 8. I think it's like micromillimeters, something like that. I always forget it, but
Okay.
it needs to be under 8. And then your HbA1c needs to be under 5.4. uh Glucose, blood
Mhm.
glucose should be it's like 80. Oh no. um the optimal hits like at 85. If it's above, like it's starting to go 90, you're heading towards prediabetes. Again, when you have your blood work done, talk with your the healthcare provider that requested it, and then they actually
Okay.
have they have the ranges. There are optimal ranges, and then there are the general ranges that they have. So those
And
are
is
three
it
things
just
that will tell you if you're pre-diabetic, because you want to make sure before head.
most definitely? Now, is
Mhm.
there a certain panel that we would ask the physicians, or is it just like, check like vitamin levels, or just kind of be specific like that, blood levels, or blood sugar levels, or is there like a specific panel like the CMED or CBC and
So it just depends. So if you
okay.
have like the lady before, she said that her rheumatoid factor is very high. Like if you have something like that, there should be indicators that your doctors will follow. And I'm sure
Okay.
there's something for sarcoidosis. I just don't know what it is. I know what the one
Oh,
for rheumatoid arthritis, But there are different inflammatory factors. I think there's ESR. Oh goodness, there's another one. And that other one tests overall inflammation in your body. It's not coming to me, but it'll come to me at a random time. Um,
Okay.
the the blood sugar is part of the general panel. The
Okay.
CBC, the blood chem, that's part of that. But if
Okay.
you have sarcoidosis, there should be other inflammatory factors that they're testing for.
Okay.
I can
And
send you, if you put your email in the chat, I can send you a little list, but it should be in the basic panel, everything but the inflammatory stuff and
okay.
insulin, because everyone does not test for insulin. That one is a better indicator, and those have to be done. The blood glucose, the urine glucose, and then the my memory. The other one all need to be done fasting. You have to
Okay.
fast for those. I had a patient come and she was like, "Oh, I was like, these are pretty high," and she was like, "Oh, they didn't tell me to fast," and I was like, this doesn't mean like you need to fast. There needs to be like you have to have a baseline. So you have to fast for
Okay.
the blood sugar indicators. But you're saying you had fatigue, so they probably do an anemia panel to make sure it's not anemia, even though your fatigue is probably from the autoimmune condition. So it just depends on the symptoms that you have. They
Okay.
should do an anemia panel in general, especially for women in perimenopause, because there's multiple causes of fatigue, and you want to identify what is actually causing it. If it's a
Okay.
nutritional deficiency, right? Let's say you're deficient in vitamin D
Mm-hmm.
and the B vitamins, B12, you're going to have low energy. So in order for them to treat it appropriately, they need to narrow down specifically what it is, what's causing it. And you can have
Oh,
multiple things causing it, but if it's a nutrient deficiency, that can be fixed with food. And then sometimes, for example, in iron deficiency anemia, they'll give you a iron supplement. So you
okay.
have to identify the cause because you want to address the things that are easiest to resolve. So if it just means you need to eat more of some vegetable, for example, magnesium is low, calcium,
Mm-hmm.
you can that's not as difficult because you know what it is. And then you can
Okay.
track and see, am I feeling better now that I've added this into my diet? And of course, it's
Okay.
not like a week. It's like I would say 3 to 6 months. It can occur before, but a lot of women are like, I want it now, I want the change now, but that's not really how the body works. It can,
Unfortunately, yes.
it can, and some
Okay.
women have like really good results with the hormone replacement therapy, and some not so much. I focus more on the nutrition part because that part will
Mhm.
support you regardless. But some women, like everything tones down when they get the hormone replacement therapy, whether it's bioidentical or conventional. So that's
And
why I always say talk with a healthcare provider who does this all the time,
okay.
all they see are women in perimenopause because if they tweak these hormones too much or they don't, so usually because I have a PA and she does mine, she starts at the lowest dose, right?
Okay.
You want to
Was
build
that the
up because the
bio?
hormones are powerful. Yeah, for me, I prefer bioidentical, but you have the right to make a decision on what you want, whether you want bioidentical or conventional.
And the
I have decided,
bioidentical, is that like the
mhm,
one that they say, oh, it's high risk for cancer causing?
no. So
Okay.
the bioidentical one is very similar to our hormones, and
Okay.
it's plant based, whereas the
Okay.
other one is from um it's horse urine is where they get that
Okay.
estrogen from. It's just a
Okay.
different type. But again, I would say sit and talk with the healthcare provider, have them go
Okay.
over both with you. If you feel that they're picking one over the other, like it's okay to say I prefer this, but you have to make that decision. You know what I mean? Like I don't force people. I just say I prefer this, but you need to go do your research. Always make sure the person works with hormones because some people they have the
And
qualifications, but they don't know what they're doing. and
And
you're going to
that's
experience that
what
side
I
effect.
was going to ask. Like, should it be like a PCP? Should it be the OB doctor? Should it be like an endocrinologist or your rheumatologist? Or, should it be a specific, and as you stated, they should know about hormones. So that was very
Yes.
helpful. So thank
And
you.
have that's all they do. So
Okay.
it just really depends because you have a lot of things going on. So I'm assuming you have one or two, maybe more doctors that are managing your, I would say, case,
Mhm.
but right? Because
Yes, I have
anytime
a
you have
pulmonary
autoimmune,
doctor, heart
yeah.
doctor, PC.
Hmm.
I have a slew of
Yes.
providers.
So you want
So
to make
yeah.
sure they're all on board, but you want to make
Okay.
sure that someone is going to be specifically addressing the perimenopause because we can't assume that an endocrinologist knows that. They should, but
Mm-hmm.
again,
Okay.
the assumptions don't help us in healthcare. So
Yes,
it's really
indeed.
important to make sure that they know what they're doing. So when I found, because I go to a PA, there are a
Mhm.
lot of doctors here in Austin. They have like med spas and stuff like that. And I'm just like, I need you to just focus on one thing so I don't have to do it for you. So
Mhm.
all she does is for, I think, what, 25 years, she's been working with women that have thyroid issues, perimenopause, menopause, and something else. And I was like, she knows what she's doing. She's working with people that have hormone issues. And then, of course, women that have hormone issues. And the thing is that, like with the thyroid, some women, it aggravates their thyroid issues. Like if they have hypothyroidism,
Um,
it's worse when they're in perimenopause. You need someone that this is all they do. You have
okay.
the right to make the decision, but I'm just saying, like, for me, I'm like, I don't want you doing 8 other things because if I have a side effect, I need to be able to contact you and you need to be able to know what to do,
Mm-hmm.
right? So you have a little bit more complex case. You have those autoimmune component. So just make sure they're all on board and find someone who can understand the interplay between all of them, right? Because you're going to be taking
Okay.
medications for different things. And
Okay.
just doing research. That's how I found the lady that I found. But yeah, you want to make
Okay.
sure. And I don't have any extra other things. I was just like, I don't want anyone um, playing with that. My mom, I think she said they gave her progesterone, and then she said her blood pressure went up and she had to go to the hospital. I was like, we're not having that. So
Okay.
just, yeah,
Yes.
yeah, yeah.
Wow. So,
Find
whew.
someone that does minimal dosing first and goes up because these are hormones. They have significant impact on you. And then, of course, you want to be able to contact them if you have a severe side effect. Hormones are
Okay.
very powerful.
Oh, that was very, very helpful. Thank you so much. Well,
No problem. Thank you.
everything has been helpful learning from and listening to the others as well. And just it just ties everything together. So I'm glad that I was able to attend and get this very informative information. Gosh, this has been
I'm
wonderful.
glad you're
Thank you.
able to attend too. Thank you so much. Okay, Soul Brown asks, do you happen to have a list of foods that you recommend that perimenopausal women should eat? So basically, making sure you're eating complex carbs. Complex carbs are, dark leafy greens, grains, whole grains, probiotics, fermented foods. I can put a list together for you, but basically
Mhm.
reducing as much of the processed foods as possible. Now, some nutritionists and some people want to rob you of all the joy of food. I don't do that. So you can have a treat, but if you know your triggers and you know how your body's going to respond to different foods, you can deal with that. But I'm not going to say cut out all sugar, cut out everything. We have to live. There's birthday parties, there's things like that. I would just say plan around those things, but focus on, um, so I kind of follow the 80-20 rule. 20 is the fun. Hey, I can have a cupcake, whatever. 80% is making sure you're getting high quality protein, whether it's from animal or plant sources. Making sure that you're eating those complex carbs because they have not only do they have fiber, soluble fiber that helps slow down their absorption of uh sugar after you eat, they help stabilize your blood sugar. Not only do they do that, they help keep you regular. The digestive system is unfortunately also affected by perimenopause. Fermented foods help with your gut because your gut affects your immune system. And when the perimenopause causes and wreaks all sorts of havoc on the gut. So it's important to, make sure you're getting that fiber, fermented foods if you can. Some women have histamine sensitivities. They can't eat fermented foods. If that's you, you know that. Stay away from it. Just eat fiber-rich foods. And then make sure you're getting that protein in. Stay hydrated because unfortunately, one of the other side effects is that women are more easily dehydrated during perimenopause because estrogen also plays a role in the fluid balance system. So it affects everything. Um, but that's what I would say. Yeah, like if you want ice cream and you know it triggers you, just know that you can't be eating it every day. But, if you want a treat, hey, I follow the 80/20. Some people are more like, let's cut everything that brings you joy out of your diet. And people are different. That may work. That doesn't work for me. So I just I know what my trigger foods are and I have them in extreme moderation. That's it. Are there any other questions?
Yes, I wanted to ask, first of all, I did put my email.
I saw it.
Okay, good. And the other question, I tried to find your clinic, but I couldn't. So could you share your clinic and your contact information?
I can, but I'm virtual. So I no longer see private clients. I contract for workers' comp, so I no longer see private clients, but I can give you my website and it's just my nutritional coaching.
Mm-hmm. Okay.
Yes. So Carmel asks, hi, I would like to know, does this info also apply to postmenopausal women? Yes, because you no longer have those estrogen fluctuations. It's completely gone. So there are three different types of estrogen. The estrogen that causes the most issues during perimenopause is estradiol, right? So when you're postmenopausal, you're not producing that anymore. And so, yes, this does apply to postmenopausal women too, because you're still losing that protective aspect of estrogen. But again, lifestyle, staying active, strength training, making sure you're getting your vitamin D, K2, magnesium, and calcium to help strengthen the bones. That's your best bet to support it with diet. I don't know. I think postmenopausal women can do hormone replacement therapy. But again, I would say to go ahead and talk with a healthcare provider that actually knows your health history and they can give you advice to that. Because it's kind of weird and I don't give advice if I don't know someone's health history. So I would say ask those questions to a trusted healthcare provider or your healthcare provider. They can look at your history and they can say, hey, hormone replacement therapy will be beneficial or not. It's always best to ask someone that actually, knows your full health history. The recording, it'll probably be out tomorrow by 12 p.m. my time. I'm in Central Standard Time. It may be before. It depends on whenever it finishes downloading its Zoom. Are there any other questions?
Thank you, doctor. It's really beneficial session. Thank you for that.
You're welcome. Okay, if there are no other questions, I have several other workshops that I've done in the past, and if any of y'all would like to listen to any of the other workshops, just let me know. I'll do that, Tiana. Just let me know and I can send it specifically to you. So again, we've done everything from heart to anxiety, we've done autoimmune, like we've touched on everything. I just have bladder, ears, eyes, throat to kind of touch on, and then we'll be done. But if you're interested in any of those, just put it in the chat and I can send that specific recording to you, and then you can listen to it. And if you have any questions, you can go from there. Okay, I will get those lists to y'all. And then thanks again. Thanks for hanging out with me tonight and asking great questions. Okay, take care, y'all. Okay, Tiana, which ones? Because there's like 13. There's a lot of them. Okay, what I'll do is I'll put like when I send you the fermented foods, I'll put a list of all of the ones that I have. They should be on the Eventbrite thing too. And you just scroll through there because there's too many of them. So what I'll do is I'll just send you all a list of all of them, and then you can look through that list, tell me the ones that you're interested in, and then I can give you a link from YouTube and you can watch them. Some are pretty short, some are a little bit longer, depending on how many people ask questions, but I like to get straight to the point, and so I'm pretty quick when I'm doing presentations. So if you have any questions, once I send those out, I'll say expect that tomorrow by 12 p.m. Okay, y'all take care. Thanks for hanging out with me and asking great questions. Okay, Martha. Have a nice night, everyone.
And you too. Thank you.
Take care. Bye-bye.